So here is how the article was published. The NHS outlives its use. 50 years after the launch of the NHS, inroads were made towards its eventual destruction through the Internal Market and the Health and Social Care Act 2012. The next step is to discourage consultants from signing contracts with the NHS. They will instead be channeled into various forms of private practice, and the government can point the finger at them for making free at the point of use impossible to sustain. The public will have a scapegoat, and that £200 per hour doctor will sound like a bargain when they need hip replacements. And here is the original as submitted before editing by BMA. The existence of the NHS is a page from the handbook of human ownership. The rulers needed the innovators to develop and test medical treatments on the population and to ingrain medical research into our culture over a lifetime for persistent rapid progression. Some 50 years after the launch of the NHS, inroads were made towards its eventual destruction through the Internal Market and then the Health and Social Care Act 2012. The current step is to discourage consultants from signing contracts with the NHS. The consultants will instead be channeled into various forms of private practice, and the rulers can point the finger at them for making the free at the point of care NHS impossible to sustain. The public will have a scapegoat, and that mythical £200 per hour doctor will sound like a bargain when they need a hip replacement. The rulers will enjoy high-quality healthcare with additional income from taxation, insurance, etc., and soon all the fuss will be over with. This was before the negotiation of the junior contract and the suggestions that the juniors should also be discouraged from signing a contract with the NHS, so the fuss isn't quite over with since this was written.